So this isn't an audience that needs to be sold on the power of behavioral science for improving policies, programs, and outcomes for individuals at every level. We all know that when you approach a system or a structure from a behavioral perspective, the potential for making things run more equitably and effectively is enormous. But how do behavioral scientists think about the role in context where the structural challenges facing a country might be so overwhelming that policymakers don't know where to start when it comes to changing behavior? What about countries dealing with political instability, recurrent natural hazards, profoundly limited resources, or unexpected hurdles that make everything even more challenging than they already were? If you're a policymaker dealing with urgent and overwhelming challenges like a hurricane or an influx of refugees from a nearby region or a pandemic, even if you can understand the importance of behavioral change for mitigating your crises, it can be hard to focus on it. In international development settings, the challenges faced by behavioral scientists can be daunting. Behavioral science teams based in individual countries, whether at the federal or the local level, face challenges around implementation and buy-in, to be sure. But what do we do when faced with dozens of governments, each dealing with a unique set of challenges as wide-ranging as a lack of infrastructure for data collection or communication, political instability and quickly changing governments, scarcity of time and money, and a daunting list of urgent needs to ensure a safe society? At the World Bank, staff have been mired in these challenges for decades. And in recent years, a number of World Bank teams, including the bank's behavioral science team, the Mind, Behavior, and Development Unit, nicknamed MBED, where I work, have been thinking about how we can apply insights from behavioral science to improve outcomes for beneficiaries, improve decision-making for policymakers at every level, from ministers to middle managers to teachers and frontline workers, and do it all by working with the existing infrastructure and priorities of countries that might be dealing with multiple crises, limited infrastructure technologies, and at low cost. So how do we do it? A core part of MBED's process is to start with comprehensive diagnostics. You might ask, what does a behavioral diagnostic look like? It looks a little bit like reading up on the existing literature, what's worked in other settings, what behavioral interventions are already out there, and what are their outcomes. But it also looks a lot like talking to people on the ground. If you're trying to make sure that people engage in a behavior, you need to make sure you understand things from their perspective. Do they understand what you're asking them to do? What do they think about your form or your message or your training? Do they know where to sign up? Do they understand the benefits? Do they think it's important? Are other people in their community engaging in the desired behavior? How do they get to the place you want them to go, whether a car or a bike? Or how do they access the information, the form, the whatever? Often the gap between a policy or program that looks great on paper from an office in Washington, D.C. or in a ministry and the desired outcome can be pretty big. And because context is so important, in general, but particularly in development settings, we end up spending a lot of time on diagnosing the existing barriers to behavior change rather than jumping to conclusions or prescribing solutions that may have worked in other contexts. We want to make sure that we talk to the people who have designed a program or policy, as well as the people on the receiving end. This process has also helped our partners, from bank staff to government counterparts, better understand the behavioral bottlenecks inherent in various systems and processes. Looking in depth at the behavioral journey of our target beneficiaries gives everyone involved a better understanding for how to develop effective interventions and how to think behaviorally in their work moving forward. So with a clear understanding of the challenges, both structural and behavior, we can help our counterparts understand the various steps each individual undertakes and where interventions might be the most effective. We also work hard to ensure we're not making things more expensive or complex. So, are there existing programs in which we can embed? Are there upcoming project components where we can inform design? The goal is to ensure that we are providing a value-add and innovative solution to scalable work rather than creating a new, likely expensive program or solution that will be challenging for a government to later take to scale. We also always look for cost-effective methods of measuring our impact. Can we use existing administrative data? What about already planned evaluation tools to determine if the intervention worked? We're not here to pitch you the $500,000 multi-year RCT that gets a bad rap. At every step, co-creation and capacity building with our partners is an essential part of the process. So a few examples. Take recent work from the World Bank in Haiti. I'd like to talk about our work in Haiti because this is a context where there are a lot of structural challenges, and we know going in that we're not going to solve everything with behavioral science alone. In a country that's uniquely susceptible to hurricanes and where climate change is increasing their frequency and intensity, ensuring that citizens evacuate to shelters is essential for saving lives. But often, individuals are reluctant to leave their homes and go to shelters. So we wanted to find out why. While some of the barriers to evacuation are structural issues that we can't solve entirely with behavioral science, such as lacking a nearby shelter to evacuate to, or earlier experiences with shelters that may have been unsafe or lacking in essential resources, after talking with individuals on the ground, shelter coordinators, and others, we looked at the barriers that could be addressed with behavioral science, and we identified 3. First, the population often does not receive the alert messages, an important outreach problem. If you don't know that you're being told to evacuate, you're not going to. Second, when the information arrives, messages are not always adapted to a format that the average Haitian understands, resulting in people not knowing where to go or what to do. And they may not understand the urgency. So if you don't know what a hurricane at Category 5 means, you don't know what kind of action you need to take when it arrives. And finally, even when the information arrives and is understood, sometimes people don't internalize the risk level. They think nothing bad's going to happen to me. Not only is it difficult for the average Haitian to believe that a hurricane is going to hit their house, but they may also be reluctant to leave their possessions behind, such as livestock. So with these 3 barriers in mind, the team decided on a community-informed communication strategy to inform public understanding of the importance and urgency of evacuation. The World Bank team partners with local teams to produce a song and music video, radio content, and text messages, and work to promote the campaign across the country. Particularly in the Haitian context, working with local artists and the community was essential to tap into local culture to co-create the messaging, both for the song and the radio messages. To distribute the messages, they targeted urban, rural, coastal, and isolated communities all over the country. The results included a video and a song with really popular Haitian artists, SMS preparedness messages, and radio messages targeting areas with low literacy rates. The kinds of messages varied. SMS messages conveyed the importance of knowing how and when to evacuate during hurricane season, with texts like, quote, "Hurricane season is here. Think with your family how you can protect your lives, your house, and your animals. For more information, listen to the news and stay connected." My Haitian Creole is rusty, so these are English translations. The radio messages included podcasts on how to prepare for hurricanes, what different alerts meant, and what to do when a hurricane hits. And the song gave advice about how to prepare and urged individuals to stay connected, pay attention to the news, and evacuate when told to. Ultimately, the campaign reached more than 4 million people out of 11 million, received thousands of positive comments and shares, triggered a positive conversation in national media, created new trusted messengers for the institution in charge of early warning systems, and crucially created new distribution of messages for the future distribution of messages, a new network of community radios and partnerships with local PR teams and the cell phone companies, Viamo and Digicel. So shifting gears a bit, where Haiti is an example of the power of behavioral science to impact change even in settings with complex structural challenges, the World Bank also works to consider how behavioral science can be used to change some of the internal barriers to equity, including biases, beliefs, and motivation. When working with teams mired in challenges related to unemployment or education, these are often crucial considerations for developing interventions that can increase effort and resilience. Behavioral science can't build better schools or create better jobs, but it can help people within those settings reframe their mindsets for better outcomes. We are not talking about thinking your way out of poverty. We're just talking about giving folks the skills they need in order to persist in challenging environments. So in Peru, South Africa, and Indonesia, the bank has worked to apply the research of folks like Carol Dweck of Stanford University, who pioneered growth mindset. The idea that intelligence is malleable, and with effort, you can change your skills and abilities, to the way students think about themselves and the way teachers think about students in schools. So for instance, an effective growth mindset intervention would have been particularly useful when I was in school and believed I was just bad at math by helping me believe that with time and effort, I could actually improve my scores and my confidence. Like lots of countries, Peru is worried about standardized test outcomes and what they mean for students, especially the increasing gap between students from high-income and low-income households. The standard approach to improving student achievement involves investing more money in teacher training and learning materials. But researchers from the World Bank, the University of Oxford, and the Group for Analysis for Development in Peru decided to take a different approach. They developed a project called Expand Your Mind, which aimed to use lessons from growth mindset to develop student motivation and perseverance. So what did this look like? The project entailed sending packages of curricular material already put together, consisting of 90-minute lessons with all the instructions and materials teachers would need, to 800 public schools in 3 regions in Peru. Students then went through the lessons with teachers and wrote an essay to ensure that they understood and internalized the material. And ultimately, the results were impressive. By measuring the level of improvement on standardized test scores, the team was able to determine that the intervention, in fact, did improve effort and persistence and increase student performance dramatically. It was the equivalent of about an additional 4 months of education. And in Peru, the team achieved this for only 20 cents per student, which is wild. So in South Africa, each of the 5 growth mindset sessions took 30 minutes. In the initial 3 sessions, students watched on individual computers 5 3-minute videos created by Class Dojo, an embed partner, during their after-school program over the course of 1 week. The videos followed 2 friendly age and race-neutral monsters during their journey of learning, failing, learning how to cope with failure, and trying again. And after each video, students participated in reflection questions. In Indonesia, nearly 160,000 students received the intervention, making this one of the largest growth mindset applications to date. The intervention included a set of 4 comic books to make the messages as simple, attractive, and contextually relevant as possible. In both South Africa and Indonesia, the team similarly found improvements in student test scores with a very important detail. Often the scores improved most for students from poorer, more vulnerable communities, suggesting that these interventions have a real potential as a low-cost, high-impact tool for leveraging student effort and improving performance for the most vulnerable. While the growth mindset results in these countries are impressive, what's also essential is the scalability of the intervention. Last year, as students moved to remote learning across the globe due to the pandemic, the Ministry of Education in Peru implemented a growth mindset lesson based on the earlier project to students nationwide through their virtual learning curriculum. And as we know, what's important in development context is not just to show that something works, but that it's scalable, low cost, and effective over time. So it's been a pleasure to share some of the work of my team, the Mind, Behavior, and Development Unit, and the World Bank as a whole, and what we're doing to bring behavioral science to the development space. If you want to learn more, I'd encourage you to take a look at our website, worldbank.org/embed. Our work spans the globe. If there's behavior to change, we're interested in changing it.
You mentioned the importance of applying behavioral science to the policymakers themselves. Now, it occurs to me that there are a couple of problems in policymaking. One of them is something you addressed in the case of Haiti, which is that if something makes sense, therefore you think it's going to work. So telling people there's a Category 5 hurricane, conventional logic says that's going to work. The second assumption, which I always notice bedevils policymaking, is a kind of assumption of proportionality, that to achieve really, really big effects, you've got to have really big, expensive interventions. Do you think there's a behavioral job to be done with policymakers in actually encouraging them to look more for butterfly effects, for example?
Yeah, I think it's about looking for that, but also looking internally. So a lot of what we do as a team is, what I talked about, these diagnostics, identifying potential intervention and entry points. But during that, we're also working with the policymakers to say, okay, this is what the policy program form, whatever you're working on, looks like. And here's what we're hearing from beneficiaries. So how can you, as the policymaker, as the person designing this, think a little bit more, intentionally, strategically about what you can do to improve outcomes here? So we have another project in Mexico where part of the problem is that women weren't seeing an advertisement for a program they could apply for. So you might say, I have this beautifully designed flyer, I've put it up somewhere, but if no one's seeing it, which we sort of talked about in Haiti, it's not going to work. And so we go through the same process. We design the intervention, we roll it out, we give them the results, they can scale it. But ultimately, the goal is to help them think in future designing of these kinds of things about how they can be a little bit more thoughtful in their work as well. So we're not going to be there the whole time. We're not going to be working with them on every single policy and program that they're designing. The idea is that next time when they're faced with this, they can say, let's pause, let's stop, let's take stock, and let's think about how this is going to be received by the people we're serving. And I think in sort of a more meta way of thinking about things, and this is something we think about a lot as a team, looking also at our own biases. So there's some work that you can find on our website that was done with the World Bank and DFID, looking at sort of perceptions of how people think about decision-making among the poor. And ultimately, we're biased too. So these are individuals who worked at DFID, who worked at the World Bank, who've dedicated their lives to thinking about how to improve outcomes for people in policy. And ultimately, they're not thinking about them in sort of the completely unbiased way that we would like them to. And this accounts for bank staff. This accounts for, the ministers we're working for. It accounts for maybe the frontline health workers who are serving these people, something we're thinking about with vaccine rollout. Just really making sure we understand the biases and how they're influencing these policymakers is important as well. And that's not a huge intervention. It is a lot of internal work for yourself, but it's looking at, what's something we can do as individuals to think more strategically about the policies we're designing.
Do you also think perhaps we invent too much, in that there is so much to be done in simply taking what's proven to work elsewhere and replicating it? Now, Admittedly, of course, I acknowledge the fact that you make the point that you have to tailor interventions to the specific context, that context always matters and it varies much more than people, I think, like to realize. Now, on the other hand, with the growth mindset work, that is something which was proven to work in 1 or 2 locations and which was more or less rolled out to 4 or 5 further countries. What's the balance between testing everything at an individual level and simply taking successes and replicating them?
Yeah, that's a great question. And I think the answer is we're still figuring it out as we go. So we're always thinking from the context of the development setting where you may not have some of the resources that are available to you in other countries. I've talked about this in the talk a bit. But I'll take an example that I think is quite well known from the behavioral science space, which is tax compliance. So in the UK, the behavioral insights team really pioneered this idea of using, norms to improve tax compliance among individuals. What we've done in different settings is figure out what if you have a country where tax compliance is actually quite low, right? So if you are not looking at a country that has 95% tax compliance, does it still work to send someone a letter that says 60% of your compatriots have paid their taxes on time? And if that's not going to work, what are some of the other messages that we can test? So we've done interventions in Costa Rica, Guatemala, Poland, Kosovo, a whole lot of places where we're looking at, do nationalistic messages work better? Do hard tone messages work better? Do they work better on different audiences? Because this is almost looking at it from a market segmentation point of view, if you want to get a little bit technical in that way. And can we think a little bit more creatively? So we have projects that have employed student lessons for tax compliance or public theater. So I think we're often taking what we know has worked in some settings and figuring out, and what else? If this is a different settings or different cultural norms, human behavior is very similar across the board, but is there something else that we can learn here that we haven't been thinking about or that we might not have seen in sort of a traditional, developed country setting?
I think this is absolutely fascinating. So thank you enormously for that. Keep up the good work. And we're all actually in awe of everything you're doing. We think it's absolutely magnificent. So thank you once again.
Yeah, thank you for the opportunity. This has been great.
It's a joy. Thank you.